I wanted to make you feel as good as you possibly could. Hi, before we begin this video, I'd like to thank all my current Patreon members for their continued support. If you're looking for any other content that I create on other platforms, check the link below. Now, let's get into the video. Hello there. I'm going to be testing your tingle areas from head all the way up there down to your, well, I don't need to go all the way to your toes. I'd say I just need to get down to your waist. And by doing that, I'm going to be able to test all of your tingliest, tingliest areas on your body with these special hands. Now, before I begin doing this tingle test on you, a couple ground rules need to be made apparent. You need to tell me via your eyes when I've hit a spot that lights up your brain, I'll say. How do I mean by that? In terms of tingly, super tingly, and extremely tingly. I'll be doing all parts of your body. I think I should rephrase that. I'm going to be doing all parts of your body on the front side of you down to your waist. So I guess we won't call it a full body tingle test. We'll call it the most important body parts tingle test. How does that sound? I'm in agreement as well. So shall we begin? Shall we get into it? Good. So let's start this tingle test. Now, first things first, I'll be only using these hands, and these hands will be feeling you in specific areas on your body and seeing how much of a tingle I can get out of you, how much a shiver I can send to the top of your head, from your spine all the way up to the very top of your spine. Can I get the hairs to stand up on the back of your neck? That's going to be my objective. So there'll be a variety of ways that I make this happen. So let's do test number 1. This one's straightforward, where I have just my fingers and I slowly vibrate them over your clavicles here. Just enough where you can feel them, but you can also hear how it sounds. You can hear the tingles. How did that feel? Be honest. Your eyes tell a lot more than what a word may say. I'll accept that as mediocre, we'll say. I'm just ramping things up here, remember. We are starting from slow and getting to a climax of tingles. I'm excited, and I know that you are too, to get to the very end. So, 2 out of 10, I'll take it. It wasn't supposed to be a high test. Anyways, now, let's move down to a little bit more midline of the chest, shall we? This one, I'll be running my fingers so slowly, just very faintly over you, just enough that you could feel the hands there, the fingers, the tingles, the subtle touch of fingertips brushing against your skin, but not enough to illuminate that I'm pushing on you, just enough to create that sensation of a tingle. Shall we? Remember, just little flutters from side to side, left to right, like so. Along with that, just the slightest bit of pressure. That's good. Do you feel anything going up your spine? Do you feel any tingles illuminating up you? Be honest on that one. How did that really feel? I can always work on my technique, but I need your help to do that. Now, shall we move down to just under the chest line? Mid-sternum, we'll say. This one I'm going to be placing my hands on you and giving a gestured movement of my hands in a fashion that should create movement on the hairs on your back, up your spine, radiating into the back of your head. Now, here we are. Just going to place one hand there, the other hand there. Now, subtle movements on your right side. Just feel them. Do you feel it? As my hand glides slowly across your rib cage, around the side of your arm to the underside. Just feel it. Do you feel it? Do you feel the subtleness of my fingertips just casually brushing against your skin? Just enough that it feels like a tingle, where it feels like something is there, but something may not be there as well. I can speed it up or slow it down. The tingles are up to you on how they resonate in your head. Don't give me a score. I don't want to hear it. I just want to know if you're feeling it. I don't care where you feel it, as long as you feel some type of tingle on your body. It means I'm doing my job correctly. Now, I'm going to move down to the belly, just above the belly button. This part tends to get people quite worked up in the tingles, radiating from the lower back, up their spine, to the back of their head. Keep that score to yourself. Now, just more pressure on this one. slow circles like this just around the center of your stomach. Do you feel it as I go on a circular motion? That's good. This one doesn't take as long to emit a signal of tingles entering your brain. Do you feel it? Do you feel those tingles? You're allowed to feel something new. Trust me, it's okay. That's why I'm here, to test your tingliest areas, to emit a feeling that feels incredible for you. Tingles. Tingles help you fall asleep. Now, I'm going to go down to your waistline, just at the belt line. Are you prepared for that? Good. This one will be very subtle movements like this. Nothing fast and nothing too slow. Light pressure grazing along that waistline, just on the hip bone. That sometimes has the most provocative area, the side of your hip there, on your left or right side, underneath your kidneys, to emit the tingliest feelings going up your spine, radiating, like I've mentioned, in the back of your head. Are you ready? Let's just there we go. Just enjoy that feeling. That's it. Feel the tingles going up your spine. Embrace the tingles and let them go. There we are. It's okay that it's your first time for a tingle session. Sometimes people don't really know what they're missing until they have a session of tingles. Now, it doesn't have to be a long session to feel the way it feels, those tingles entering to the back of your brain, emitting such a dopamine effect that you could fall asleep at any second, in which I hope that's the next thing that you do. How did it feel overall? How did it feel experiencing a tingle that maybe was new to you? Let me know. Let me know now. And before we end this session, I'd like to ask you one last question. If you could have one area get tingles, I'm not sure how to word this properly, or correctly is the word to use. If you could experience a tingle in your most tingliest area, where would it be and why? Hey babe, you're back. How was your day at work? It was bad, wasn't it? That's okay. You know exactly what you've come here for. That's right. We're doing another massage. I wanted to make you feel as good as you possibly could. you are the breadwinner at the end of the day, and I'm just your boyfriend who waits on you hand and foot. But whilst I do that, I practice all day my technique to give you the most incredible massage that you may have ever experienced. And I know how to make you feel honestly incredible. Come on now. You know how good I am at doing it. I can make you release your muscles in minutes. You think you're tense? Well, I don't think that. I think that I can help you become not so tense in a very short period of time. But instead, I'd like to look at you this time. I know, last time I was only able to give you a back massage and I didn't get to see your beautiful face. It's why I'm with you, honestly. Well, I'm with you for a variety of reasons, but well, as you can see, I'm with you because I love you. Now I want to give you a chest massage. I want to help your muscles release. I want to help you relax. And I think you know how good. I think you know just how good I am at making you relax in what feels like seconds, but I can make it last ages. These magical hands, my left and my right, they can do, well, you know, glorious things. Now, first things first, you've got to get rid of that shirt. Me. Babe, last week I told you to fix the AC machine, and whilst you are the breadwinner, you're also the handyman of the house. I'm certainly not, and that's why my shirt's off, because it's so hot in here. Obviously because of you as well. Now, get rid of that shirt. Good, that was quick. That took seconds, I'm impressed. But it doesn't take a lot for you to impress me. That sounded wrong, but you know I'm so impressed by you. I think whispering is much more in the moment of, it helps me get you relaxed that much more. Now, let me just start right there. How is that? Breathe with me. Let that tension go as my fingers slide over your skin. Just feel. Why is your chest so worked up? Look at it. It's so hard. It's not usually that hard. I know what it is. I know what's got you rock hard. You were at the gym, weren't you? were late coming home. You were working out those pectorals of yours, and they, I must say, babe, they are rock hard. Look at them. My God. Anyways, let me do what I'm good at here, and that's making you release yourself of all the tension you feel in your chest. I'm gonna get rid of all your built up tension. Just close your eyes for a second. Just feel that. You can breathe with me too, it helps. Breathe. Enjoy it. It's a massage. You're supposed to feel good. That's it. Right there. That's the spot, isn't it? That's it. Make that face. I know it feels incredible. That was one hard muscle, but my hands of magic turned that muscle soft pretty quick. It's not something I'm proud to say in a sentence, that these hands can turn a muscle soft, but in the instance of this, that muscle is so soft. I felt that release. Did you? The way the muscle just let go, the way it released itself, an explosion of dopamine, that feeling of just pure relaxation. You know what the thing is, though? You know what the best part is, though, babe? You have two pectoral muscles, and we've only released one. We've only let one get that full tensile release, and I'm about to make the other one feel even better. Just breathe. I'll mimic your breathing. I was reading today, babe, in a book that when we breathe together in tandem, it relaxes both people simultaneously. So you just start breathing and I'll follow suit. That's it. That's it. Let that tension go. That's it. I can go faster on it. That muscle is so hard. I can't wait to make it release. For you to feel that tensile strength just drop off. And get the relaxation chest. I'm actually a little envious on how hard it got. But don't worry, like I said, I read in a book today. I know. I do read books, babe. I study for you. I read that when we have that tantric breathing, when we breathe in tandem together, it relaxes both of us, but especially you, and you felt it. I was giving it all I had when you were hard. That muscle did not want to release, but these hands made that hard muscle release in your chest. And now look at it. Soft as can be. Look at that, I can run my finger over it. Like it's nothing. It's smooth as butter. I know. I think secretly you worked out at the gym a little too hard. So that I could give you that release that you were looking for. One more time on either side, babe. No. What I'll do, I'll just massage it really gently. I'll make sure that you feel as good as you can when you go to bed. I know. My hands are the best at working a really, really hard muscle to get that big release in your muscle so that you can sleep as good as you can with a really fully soft and not hard chest muscle. It's nice to see you again in my office. It's been some time, hasn't it? I think you're overdue for this cranial nerve exam. But don't worry. We're friends, right? Good. Because of that, I'm not upset that you're a couple months past. I have a regimented schedule as a doctor, and I'll let you off this time. Just next time, please don't be late for the appointment. I scheduled you last week and you didn't show up, so don't worry. It's okay. You're here now, and that's the most important part. So, let's just get into it so that we can work on this session of testing your nerves 6 months after your brain surgery. It's better safe than sorry, right? There we go. So, first things first. We've done this many times. That's okay. I'm going to be looking into your eyes, top to bottom, left to right. I've got another flashlight. So this is the one where I just search specific areas in your eye. But this one, that one will help me. It's a new one. It's a new instrument I have. It will help me look deep into the back of your eye. So, standard, please just look up for me. Thank you. Alright, so what am I issues with that in terms of following my hands? Good. How many fingers are you seeing here? Good. How many now? You just tell me how many you're seeing at a time. Good. Good. Any issues with quickly doing the math in your head on how many? No, good. Do you remember the first set of fingers that I gave you on how many fingers I held up? Think. Good. Not too hard there, remember that. So, eyes are doing well so far. There's a lot of cranial nerves to look at from just your eyes. I'm just going to cover that eye there. Can you still see me? Good. How about this eye if I cover that eye? Can you still see me? Good. And if I cover your eyes completely, can you see me? No, but you can see me now. Excellent. I need to get my trusty notebook. Left it right there on the table. I was doodling earlier. I was a little bored. I'll go to another page. There we go. Fresh page. Just got butterfingers, it seems. There we go. Fresh page just for you. So, cranial nerve 1. Okay. Just need to look back. Previous notes there. Okay. Good. Won't need this again. I'll put it on the table. So, tested your eyes. Everything's good there. Let's have a little listen to your heart. If you just breathe easy for me, please. Thank you. Take a deep breath in. You can let it out. Another deep breath in. And let it out. Good. Just gonna do your backside here. Deep breath in. And you can let it out. Deep breath in. Good. And you can let it out. Good. One more time, just gonna listen. Just breathe normally. Good. Alright. Heart sounds good. Your lungs sound good as well. Just gonna feel your pulse here. 3, 4, 5, 6, 7. Good. Heart rate around 63 beats per minute. That's pretty good. Respirations are normal, about 15 to 20 per minute. That's perfect. Anything lower than 12 would be an issue, but you're doing good. Now, where was I here? Just gonna do a soft and hard type pinpoint test. You just tell me when I touch your face if this is a soft piece of the brush right here, or if it's the hard end. Good, so just tell me. deciphering which is which, the soft or the hard end. Good. I'd like you to put your arms up for me just like this, please. I'm going to be pulling your arms towards you. Sorry, this side. I'm going to pull that towards me. I'd like for you to resist. Good, so just arms up. Good, and resist. Resist as I'm pulling towards you. Keep resisting. Good. Any issues trying to hold me back from pulling your arms apart? Good. Same thing again like this, except I'm going to be pushing in towards you. So I'd like for you to resist that. So hands in and resist, 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 resist. Good. Any issues with that in terms of me blocking from having you touch your nose with your fist? Good. Now, I'm going to test your shoulder reflexes, see how those work. So, you're just going to stand nice and floppy like this, nice and floppy. I'm going to get you to shrug your shoulders up like this for me. While you do that, simultaneously, I'm going to be pushing down on your shoulders. So, don't let me push your shoulders down. So, start with your shoulders up. I'm going to push down and resist, 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 resist. Was that hard to hold them up? Good. Now I'm going to hold your shoulders down and I'd like you to try and push up. So, got my hands on your shoulders there. I'm pushing down. Now, pull your shoulders up. Do a shrug. Come on, resist. Keep pushing up. Push, push, push. Push, push, push. Good. Any issues with that? No. Good. Nice and simple test this time. Can you just open your mouth for a second, please? Just need to have a look here. Tongue to the left, please. Thank you. Tongue to the right. Good. Just put your tongue on top of your roof of your mouth there. Good. And then just, can you do this for me, please? Just need to look at the side there. And then to that side. Good. Can you stick your tongue out for me and say, ah? Good. Keep doing that. Keep doing that. Just need to put my finger on your tongue there. Push that out of the way. Keep doing that. Good. Good, good, good. Alright, last little part of the test here. Just need to measure the distance between your eyes. Make sure it is still current. So, if you could just stay still for me, please. Super still, thank you. Good. Great. Let's measure your cheekbones side to side there. That's good. Good. Put those away, don't need those. Yeah, overall, you are looking great considering you're 2 months overdue for this exam. No issues with your cranial nerves. I'm going to assume that our surgery that we had those 8 months ago was a success. Do you have any questions for me? No? Okay. Well, I will be seeing you in 6 months' time. Please remember to put that down in your calendar. I know we are friends, so I'll let it slide this one time, but I'm a busy man. I have other patients to tend for, so please, please, next time, just be on time. What's that? I know. It's okay. The next time that this happens, just ask yourself, just say, what do I have to do today? Yes. I need to get a cranial nerve exam. Put it in your calendar. Pardon me. Yes, that's exactly it. So, actually what you can do is in your calendar, just type this exactly. Cranial nerve exam done by Whoa ASMR. Underline, underline, underline. Put a date. Set it for a reminder 2 hours before. It's the easiest way. It solves all your issues. Now, before I go, do you have any other questions before I let you sort of welcome to a muscle tapping session. I'll be your host today, Whoa ASMR, and we'll be going over muscles, specifically the tapping of muscles, seeing how they sound when you go over specific spots of the muscle, and you let me know which one you think is the best one. How's that sound? Great. We'll start with the shirt on, and then if need be, we will remove it to see more of the muscles to tap. So, first things first. Let's start with the chest. The clavicle definitely sounds different compared to the chest. Wouldn't you agree? I'd say it sounds different, as opposed to a little bit of slapping. And then a little bit of rubbing. Obviously, rubbing the fabric is going to elicit a different sound as opposed to the skin. Have a listen. Can you hear it? Can you hear the difference? That's good. Now that we've done the sounding of the chest, let's work on the shoulders. So, obviously the tapping of the shoulders sounds like you're tapping something. Let's try rubbing. Now, you may notice a little difference in the sound on this shoulder as opposed to this shoulder, because this shoulder has some hustle butter on it. If you're not aware of what hustle butter is, it's tattoo cream. Makes your tattoo a little bit more vibrant. So, just have a listen. So there's that arm, and then listen to this one. Quite a difference, eh? Just very different. This one's more sticky, more tacky is the word I'll use, as opposed to my left. Difference in when you have oil or cream on your skin as opposed to when you don't. Quite a different sound that it makes. The neck. Can you hear the noise coming out of my mouth? When I tap my neck, an audible noise comes out of my mouth. It's hard for you to hear. How about when I tap my cheeks? You have to hold your breath when you do that, because if you breathe out while you're doing that, it's going to muffle the sound. Now, let's move to the arms. We'll do the right arm first. Let's see if the peak of these biceps creates a noise. Obviously, it's going to create a noise. But in terms of difference compared to your forearm, also remember there is the cream, the hustle butter. You can ignore this. This is almost healed. This is a few weeks old. It was my whole arm earlier, so it's just a bruise. That's tapping. Let's do rubbing. Very different. That's got the oil on it. Now let's rub this side. Not too much of a difference in terms of audible noise, differentiating from the left to the right. Not enough, I think, for the microphone to pick it up. In here, I can obviously tell the difference. Now, traps. If you cup your hands like so, as opposed to tapping, let's give an example. We'll do a cup and we'll do a tap. Can you hear a difference? I can't. If you can, you have magic ears. Also, if you haven't already done this, it's probably best to be listening to this with a set of headphones in to really get that full experience of hearing the noises that you're hearing. So, let's see. This is definitely an audible noise compared to here. The difference in textures, the difference in fabrics, the difference in skin to fabric. Very different from farther away. This side definitely is not as fun to rub because of the cream on there, the whatever you want to call it. I keep calling it hustle butter. That's what it's called. It's just a lot to say. So the cream on my arm compared to here. Let's not forget the forearms, though. The forearms are crucial to everyday life. Let's see how they sound. I'm finding a difference on the inside to the outside. Especially in this crevice. Can you hear it? Let's try the other side. Not as good. Realizing now that filming this video with this cream on my arm is not giving the best effect for using your right arm as an example of rubbing. Tapping, sure, I can tap all day. Shall we go faster in the taps? Really see what it sounds like if you tap at supersonic speed. Whew. I tell you, that gets your heartbeat up. I'm breathing hard from that. Never have I concentrated so much on tapping my forearm. Now, have we done the back? I can't really show the back as much because then I'm looking the other way. And that doesn't really help when I'm trying to create a conversation between the two of us. Nobody wants to see the backside of my head anyways. Now, let's do, well, we've already done that. We've done the chest, the neck, the mouth, the difference in fabrics on either side here. Which one did you think was your ultimate favorite? I know what mine is, but I'd love for you to let me know in the comments. What was your favorite? Which moment or which tapping of the muscles did you enjoy the most? I hope it was something that you did enjoy. I haven't done a tapping session in a while, and I figured why not just let you enjoy the sounds of getting tapped. It's unique. It's different. Muscles sound good when you tap them. So, like I said, we went over the biceps. We went over the triceps. Oh, we didn't do the triceps. How do they sound? They sound pretty good. They sound muscly. That's the word I'll use. They sound muscly. So, next time you want to see a tapping video, just come back and watch this. And I'm going to leave you with a question. If you could tap one muscle to get a beautiful sound, which one would it be?